Welcome to Mental Health in America. This is Selanie Sanone-Leavitt, family nurse practitioner for my health policy and special populations class. The background and prevalence of mental illness in America. Serious mental illness, otherwise known as SMI, affects 4% of the United States population. 9.6 Americans have substance abuse and mental health issues. This is per SAMHSA, which is the Substance Abuse and Mental Health Administration. Nationally, 42.5 million Americans adults experienced mental illness in the last year, 18.2 of Americans in 2018. In the past year, 20.2 million American adults had a substance use disorder where it was either drugs or alcohol or both. This is 8.4 of the United States population. 7.9 million people had both mental disorder and substance abuse disorders. 16.1 million adults aged 18 and older experienced a major depressive disorder in 2015. In 2014, 11.8 million adults perceived unmet needs for mental health care. Homelessness and mental illness. In 2015, greater than 564,000 people were homeless in the United States. Approximately 550,000 Americans are now considered chronically homeless. 140,000, 25% of these homeless had serious mental illness. 45% had some mental disorder. 356,000 persons in jail or U.S. prison systems have serious mental illness. Emergency departments and prisons have become de facto psychiatric hospitals. Growth in our prison populations and homelessness is due to the lack of mental health services. Our fellow American citizens are falling through the cracks. Public psychiatric hospital beds have fallen 17% since 2010. There are only 11.7 beds per 100,000 people. What defines mental illness? We look into the background and prevalence of mental illness to answer this question. The Patient Protection Affordable Care Act, it was constructed to strengthen and innovate health sectors. Primary care, long-term care, mental health services, create models of care. Community health, medical homes, incorporate quality as an area of reimbursement. Service models, example, patient-centered medical homes, encourage care coordination and reduces costs. The Affordable Care Act initiatives aim to improve mental health by encouraging integrated care models and move Medicare and Medicaid into a capitated system. The mentally ill are less likely to be insured. The Affordable Care Act provisions expanded health to care of individuals 133% of poverty level. Preliminary data suggests this strategy has been largely successful in states that expanded Medicaid coverage. Critical practice policy areas. There is a decreased life expectancy for those with serious mental illness. Integrated care has evolved. Behavioral health care homes are now being co-located in medical homes that provide holistic care. Population health is the concept of wellness and prevention. Population health and patient-centered medical home are primary-based care teams of professionals who coordinate care for those with complex healthcare needs. The aim is to address the social determinants of mental illness, such as housing, substance abuse, and chronic disease, as well as cognitive impairments. Value-based systems are measured with UDS measurements, and SAMHSA, which is Substance Abuse and Mental Health Services, oversees much of these systems. Barriers to care management for the mentally ill. There is a two-way relationship between homelessness and mental illness. Where do we begin? Affective disorders such as depression, anxiety, bipolar disorder, schizophrenia, and psychosis are among the most common types of mental illness in homeless populations, as well as substance abuse. Homelessness increases psychiatric stress. There are higher levels of alcohol, drug abuse, and lower levels of perceived recovery in the mentally ill. Homeless adults with mental illness who experienced abuse and neglect as children are more likely to be arrested for crimes or be victims of crimes. There are not enough psychiatric nurse practitioners nor psychiatrists to take care of these people. Gaps in access to care for individuals with mental illness in recovery. Value-based care of the Affordable Care Act makes measurement of single episodes less relevant. When people relapse, they fall through the cracks. Healthcare reform has left behind disenfranchised populations, example, incarcerated prison populations and the homeless. They are often too mentally ill to navigate the system. They have no address. They have no support systems in place. Sex offenders are usually unable to obtain housing after serving their time due to sex crime databases. A root cause of growth in both populations is lack of mental health services. There remains a serious problem with lack of access to treatment and its sequelae. Needed policy change. Advanced practice mental health nurse practitioners have been recognized as an answer to primary care workforce needs. FNPs are often utilized in mental health care due to lack of psychiatric mental health nurses. Mental health APRNs are licensed to provide full scope of mental health services. They could provide cost-effective mental health services in community-based clinics, thus addressing provider shortages. Cost, quality, and access are the three underlying principles for the evaluation of APRN practice. Cost outcomes for mental health NP practice could be assessed in cost savings, and decreases in emergency services and hospitalization could enhance policy change and increase funding support for mental health nurse practitioner education programs. Alignment of APRN practice with principles of healthcare reform are some of the unifying efforts needed. Nurse practitioners must create coordinated, integrated systems of care with full practice authority and focus on policy that removes barriers to integrated care expansion. We must recognize and address critical policy arena of health insurance and payment reform, address the state mental health care budget shrinkage and lack of inpatient beds that is a growing crisis in America, engage in advocate for funding to maintain mental health inpatient beds and outreach mental health shelters. Conclusions. The importance of mental health in America. Recovery is a journey of healing that enables a person with a mental health or substance abuse disorder to live a meaningful life in his or her community. Combating the stigma is bound with the ethics of distributive justice, which requires that all citizens have access to health care needed for living a full human life. As APRNs expand their vision of mental health to include community, they can assist in building an environment that supports health recovery and resilience. It is essential that we, as mental health professionals that care for clients, refine our vision, articulate it clearly, and disseminate it widely, advocating for the mentally ill and the homeless populations. Thank you for your time. The rest of the presentation and supporters can be viewed on my PowerPoint presentation. Have a good day.